When we think about the role of a university, it's easy to think about the students who are college age or in high school, who aspire to greatness and can come to Michigan State University and have the opportunity to seek that greatness with world-class faculty, with world-class assets, so that they can really be competitive as they move forward with their career. But universities are also very much a part of the community. And if you look at the array of activities that Michigan State has, not simply in East Lansing, but all across the state and indeed around the world, our work with children play a very important part of our overall academic programs or overall outreach and engagement programs. There's been much discussed in our own community about how best to think about children's health and how we as a university, in partnership with Sparrow Hospital, can in fact make a real difference in the areas of children's health. Now, we're a community that has to focus on its assets. And we're indeed very proud that we have actually, in the last 2 or 3 years, grown the number of physicians working with children in this community. So we believed it made eminent sense in listening to the concerns of the community to say, let's put those resources together. Let's find a way that we can work together in the same space so that parents have a one-stop shop, a place to go without worrying about whether they have to see an MSU person or a Sparrow person or someone else, but they have the services aligned and available, and those specialty and subspecialty individuals can work more as a coordinated group, even through the basic mechanics of just getting an appointment and those kinds of things. Because we do recognize that for many of the population that is using the services at Sparrow and also using the MSU group, that transportation, costs, those kinds of things are real issues. And having to take time away from work is a problem. It's a challenge. But we also recognize that it's not possible to have everything in the world right here. So the question is how to make better judgments about what should be here and how we partner with others to make sure that we can bring resources in episodically that are needed by the community but not necessarily needed every day in the community so that it's financially viable. Because financial viability is important, not because we're out to make a lot of money, but because you have to be able to be financially viable. We know there's much to be done, and this is a step. But it's also important, I think, as we look at Lansing and the greater Lansing area as a place for kids, that you see the value of the entire network that will be developed across particularly the College of Human Medicine, but also the College of Osteopathic Medicine. As we're interviewing new chairs of pediatrics, one of the neat things that's occurred in those interviews is that people see the potential of using the entire network. It sets us up to be able to bring in new innovations, new ideas that can help save people's lives that could not otherwise be possible if we were just one small place, isolated as one small place. So there's extraordinary value in this network. I know that no matter what we do, it will never be enough. Because if you look at in the eyes of any child, they have to be the most important thing. And so our commitment is to think about what we do by looking in the eyes of any child, but recognizing that we have to provide an array of services that works for our community. And it's that delicate balance that we know that we're going to continue to work on. And we need to get this grounding by the co-location of the practices, by the call center, and some other things we're going to do to bring in some additional subspecialty care into the community. And we'll simply move from there, recognizing that our commitment is to Mid-Michigan, to Greater Lansing, and to those children whose lives depend on our care.